It is a pleasure to be here and to have the opportunity to present our narrative review entitled Mobile Applications for Mental Health Care and Rehabilitation, a Global Narrative Review. Background: mental health disorders affect over 970 million people worldwide, yet access to care remains limited, especially in low and middle-income countries. Barriers such as stigma, cost, lack of professionals, and geographic isolation worsen this gap. However, digital innovations, particularly mobile health applications, are creating new opportunities by offering accessible tools for therapy, education, symptom tracking, and rehabilitation. Objective: this review aims to examine the global use of mobile applications in mental health care and rehabilitation by analyzing their core functions, intervention approaches, and target user groups. Method: this narrative review used the Scopus database with keywords on mobile health apps for mental health care and rehabilitation. It included 2024 English language articles focused on app-based interventions. Non-mobile platforms, editorials, and opinion pieces were excluded to ensure relevance and evidence-based content. In this method, the publish or perish tool was utilized to support the literature search process. After screening, 167 studies were excluded and 33 underwent full text review. Of these, 23 were excluded for various reasons, resulting in 10 studies being included in the final narrative review. Result: from an initial pool of 200 sources, 10 peer-reviewed articles were selected, representing diverse app types such as mindfulness tools, AI-driven interventions, digital therapeutics, culturally adapted platforms, and caregiver support apps. Application identification involves recognizing and classifying M-Health apps by their functions, target users, and therapeutic goals, helping to map global digital interventions for conditions like depression, anxiety, PTSD, and caregiver stress. M-Health applications for mental health care and rehabilitation serve diverse users, from individuals with mental health conditions to specific groups like healthcare professionals and indigenous youth, offering both general and context-specific interventions that reflect their adaptability. Application implementation challenges: the use of M-Health applications for mental health care faces technical, operational, and social challenges such as reliance on complex systems, low digital literacy, and limited access that hinder their adoption, scalability, and equitable implementation. Conclusion: in conclusion, mobile health M-Health applications hold strong potential to enhance mental well-being and cognitive health, particularly in underserved populations, but their impact depends on overcoming barriers like technical issues, privacy concerns, and lack of clinical integration through inclusive design, interdisciplinary collaboration, and equitable implementation.